So let's begin with a short introduction. I am sitting opposite of a very good friend of mine, and I really appreciate the scientific friendship. He is my guru when it comes to all allergology questions. And when you treat patients with allergic problems, you need to. It is so complicated that you really. That you can be very happy as a doctor if you have someone to ask. This person is Dr. Shahid Abbas. He is a consultant immunologist and allergologist, and you studied in UK and US, and you are from Pakistan, and you have clinics in Pakistan. Shahid, please tell the people who are listening.
Yeah, a little introduction about myself, as I'm a little person allergy and immunology. But in order to help my patients more, I did specialization in dermatology also. Right. So because my patients are coming with the allergy affects every system in the body from head to toe. It affects the lungs, causing asthma. It affects the same allergy affects the skin, causing urticaria, eczema, atopic dermatitis. The same allergy affects the nose, causing allergic rhinitis. The same allergy affects the brain. It's called brain allergies, causing lack of it. It affects the memory concentration of the patients. It affects the causes of fatigue and tiredness. It causes irritability, aggressiveness in the children. Allergy causes night wetting in the small children. They who wet at night. They have milk allergies. They drink cow's milk at night, and then they have night wetting. So when we treat that milk allergy, they are all right.
So Adeline, every system, what I learned also in our last talks already from you is what people need to understand. Let's say you have an allergic rhinitis. This is just the expression of allergy in the nose.
Yes.
But you have the allergy in your entire body.
That's right.
Yeah.
Because why a person takes an antihistamine? What? Because histamine is causing the allergic symptoms mainly. The other things are there. And where the histamine is produced, these are produced by the mast cells. The mast cells are in millions in the body from breathing to toe.
Yeah.
You are a very senior consultant. You know it very well. That there's the blood vessels everywhere is mast cells are there in the connective tissue. Everywhere.
Yeah.
So whatever we inhale, whatever we eat, where does it go? Ultimately, it goes into the blood.
Yeah.
And with blood, it circulates all over the body.
Yes.
And so wherever are the mast cells, histamine is produced. So a person having allergic rhinitis, he will not only have allergic rhinitis. If you probe in, he will say, my memory concentration is affected during these days. I feel feverish these days. I get irritable these days. I feel upset these days, uninterested in mood swings are there. He says, he will tell you if you ask him. He will have irritation of the skin also. He will feel there are digestive upsets also sometimes. But he will not tell you if you don't ask him.
Well, see, on that thing I observed is that allergic rhinitis patients often have this dry skin of their eyelids. Is there any term for that or so?
Because with allergic rhinitis, along with allergic rhinitis, there is allergic conjunctivitis most of the time.
Ah, okay.
So with allergic conjunctivitis, below the periorbital areas, their muscles are thickened. So the one is a main organ which is affected. The other organs are mildly affected. So the skin around that area also becomes allergic.
So when we as ENT have a patient with a runny nose, so one of the first Arabic words that I learned here is hassasiyya. And the patients say, I have hassasiyya. I don't know if the translation is right, but it was translated to me as allergy.
Yes.
So it became clear over the years for me that there is a real misconception about what actually allergy is. I think the majority of the people thinks if they have once a runny nose, this is allergy. And then they say, yeah, I'm allergic to everything, to the environment, to the dirty air or whatever they name it. But my doctor said I have allergy, but they don't know against what They don't know if it's really true that it's allergy. It can be so many other things. Is allergy actually very common?
Yes. Yeah, basically, can we discuss something? Why a person gets allergy? What happened suddenly that a person develops allergy at any age? Previously, he had no problems at all. We discuss this thing. This is very sure. If you want, go ahead. So there, a person inherits genes of allergy. For the common man, I would like to tell them that what is a gene? Gene is a computer code God has inserted into the DNA of every person. That he will have such characters, physical characters. He will inherit from the parents. Such will the color of the hair, color of the eyes. All is written. The genetic disease is also written. Like diabetes is written, allergy is written.
And how common is that?
About more than 60%. So more than the world is having allergies.
So it is actually more normal to have the genetic code for allergy than not to have it.
No,
Yeah, so if 60% is the majority, the majority is genetically coded to be allergic.
develop allergy any time in the life.
Yeah.
Now, what happens? Why suddenly genes get activated? These allergic genes get activated by any stress on the body. And what stress can be? In fact, the severe infection. During COVID, you must have seen huge number of people started having allergic rhinitis, urticaria, huge number in degrees.
Yes.
Because that attack the immune system and that allergy is also immune disease. It can be pregnancy, can be delivery, it can be mental trauma, it can be a physical trauma, severe accident. Suddenly the genes get activated due to any stress. And then that person can develop allergies. He starts having allergies. It is not necessary he will develop allergy. He may develop urticaria. He may develop brain allergies. He may develop irritable bowel syndrome. He may develop chronic fatigue syndrome or asthma or all together. Then there can be shifting of organs. A person having allergic rhinitis, 90%, as you know, they ultimately develop asthma.
So we have we have number one, the genetic predisposition. Yeah.
Yes.
Number two, we have the stress.
Yes.
So what else?
Environmental factors.
So the allergen must be there, or what is it?
Initiating factor is an allergen.
So if there is,
So it has to be there.
yeah.
But there's very interesting question.
Yeah.
A person living here goes to USA, he's allergic to house dust mite. House dust mite is also in USA, but he will not have any symptoms. Why? Because there is stage of sensitization. He will take 3 to 4 years to sensitize again. Because the compounding factors, environmental factors are different over there. So he will not have symptoms for some time. But after some time, he'll start again having the
Or can it be that the house dust mites in America has a different?
No, American and the Ferni and the Terranescens, two species. So both they cross-react with the antigens. They have common antigens.
I also heard that at least in Germany, the house dust mites prevalence is more in the winter time.
Yes.
And less in the summer.
No, because they are mostly indoors in the winters. People are indoors mostly. That's why they are there. And then due to the heating system, they are so minute particles, they come out.
Yes.
They're like ions,
Yes.
They circulate them because the particles, it is not only the house dust mite, even they affect
Let's talk about the house dust mite later, but I want to put out what you initially started. So we want to talk about the reasons for allergy. So we have the genetic predisposition. We have the environmental factors. We have the stress
on the body.
So this is all. Well, this is all. I learned the 3 P's: predisposition, presence of allergen, and penetrance of the allergen. That it penetrates the body. That is basically the stress factor. Yeah. If you have a stress factor here, the allergen
genes get activated.
Yeah.
They are activated then. Then it's the process starts. A person, for example, two married people, husband and wife, have genes. They don't have symptoms. They have genes of allergy. 3 out of 4 children will be developing allergies any time of their life. One may develop at the age of 1 month, the other may develop at the age of 60 years. That's according to the response of the immune system and the other factors which activate the genes. Genes are there. So it is not necessary. People, they say, I suddenly have started having...
My father, he had severe asthma, but I think it was not allergic asthma. Only, but I never got any of these symptoms. any allergic reaction or anything. But I can say when I eat tomato, I feel with tomato, I feel sometimes a strange sweating on the tongue also. Yeah. So this is already an allergic reaction, isn't it? Yeah. Also, I have it sometimes with pineapple, or when I drink certain beverages, I need to sneeze. Yeah,
You have it.
this is also allergies. But now, if people have allergies, does it always have to be severe? What are the expressions, the amount of expression that an allergy could have?
Severity.
So compare to this.
The severity depends upon the amount of exposure to the allergen. If for example, a person reacts, has a peanut allergy or any other allergy, if he has a little, he will have a lesser reaction, and also the reaction, the severity of the body, how to react to something. So for some people, little peanut can cause severe anaphylactic reactions. For others, 2-3 peanuts should be eaten, then they have reactions. It depends upon how highly charged his immune system up to that allergen has been done. So if the immune system to particular allergen is very hypersensitive and frequent exposure had been there, and he has developed highly, the very severe reaction to something, then he will react very severely.
Okay, good. So there are two factors basically. Number one is how the organism is, let's say, prepared, how massive your organism, your body is prepared for every action.
Yes, that's right. And how much is then host of the allergen there?
Yeah. So if you had frequent, let's say you are allergic to nuts, yeah, to peanuts, and you eat peanut once, you will have no reaction.
No, but if you are already sensitive to it, and you even slight peanut, even smell of the peanut will cause severe reaction.
Really?
Yes, that can cause very severe reaction. Smelling.
Okay, let me rephrase this. Let me rephrase this. So let's say a person who is genetically predisposed to become allergic has their first contact to peanuts at all in their life through maybe baby
Mother's mash, because he has been taking
mother's milk. Yes, damn. So without even having touched one peanut, you can have already the peanut
That's why
related.
that is classical peanut eating is important. But if a small child is allergic to peanut and he's showing reactions and he's not eating peanut, still he's having reactions, and his mother must be.
Isn't it then better for the mothers to give formula?
Why those things?
So to give formula, if they have already, let's say, unless they have a very healthy own life, or for the allergic mother, isn't it better to give formula to the baby then?
Yeah, depends. If the baby is not having any allergies, then nothing to worry about it.
But how do you know? Maybe your baby gets an allergic reaction when you feed them some poison.
And for example,
Bang.
whenever a mother feeds a baby, and he starts, say, crying or shouting or kicking the legs, you can feel he's having some reactions. Then stop that mother's milks. Try something else. Then, it is not necessarily that he will have asthma. Small child, the babies can have behavioral expressions, behavioral alterations, like kicking the legs altogether, excessive crying. He will not stop crying, and whatever you do, he will not stop crying. So his reaction is very
with the reason for this non-stop crying. This could be the reason for the non-stop crying. But there are probably other
attentive. Stop crying without any reason, and always crying, always restless. There's something going on in the body. It should be diagnosed.
And then you need to do the allergy test.
So if it is very small, I'll do this specific IT
first.
But then if it already comes out,
So you need to draw blood from the infant.
that's important.
Okay.
Really,
This is again. I mean, this is the thing with Shahid. Whenever I talk with you, I learn so much. I get to know so many new things. And I was thinking I'm an expert in allergy treatment, but there's again.
I always say I learned from you, the sister. I was so motivated and so educated. So
Good.